So here is the headline. Half of claims on the UK's benefit bill, half of claims for Britain's main benefit will be for poor health by the end of this parliamentary term. So keeping people who are too poorly to work in a state of some comfort, but let's be clear, not much, could hit £100 billion a year for the very first time. And the Times has a line in the second paragraph of this article, which I find simultaneously utterly predictable and somewhat surprising, because it seems to me to have been missing from a lot of the coverage. And that line is this: a post-COVID surge in claims. Now, that is a merely chronological commentary. That is simply a calendar-based contribution to the conversation. Post-COVID. So you look at the calendar, you look where COVID landed, you look at the graph of sickness claims, poor health claims, and you see the marriage, you see the point. But you cannot derive causation from correlation. I mean, even if you think the evidence is obvious, even if you think it's as plain as the nose on your face, you can't actually prove, if you want to get all epistemological about it, or you can't actually prove that just because every crow you've ever seen is black, the next crow you see will be black. You cannot prove it. But it's got to be true, hasn't it? That this isn't just chronological or calendar-based. This is medical. The soaring cost of ill health is one of the main reasons why we are going to have to pay a bit more tax. We need better public services for a number of reasons. I hope I don't have to explain this, but looking at some of the coverage of yesterday's budget, I think perhaps I do. Think of me as a sort of antidote, if you like. So one of the ways in which you bring down this claim, this bill, is by making people better, is by making them healthier. So investment in the NHS, built upon tax rises for some people, will shorten waiting lists, improve treatment, and allow people who want to work. And I think the distinction between... It was David Hume, Roddy. Well played. David Hume was the Crows analogy. Can we put Roddy to the top of the class, please, Adam? Is that all right? Can you send him a gold star? Well done, David. Well done, Roddy. You look at the spread here. You look at what has happened, and you have to conclude that an awful lot of people have not received the help they need to recover from COVID-related conditions. And I don't fully understand why this has been so... why people have been so shy of this, so wary of this. I understand two or three things about coronavirus, COVID-19 conversations that seem a little bit impenetrable from the outside. I think that an awful lot of commercial interests, most obviously landlords, were threatened almost existentially by the combination of lockdown and the subsequent popularity of working from home. So you can understand why. If you own a newspaper and you also have a lot of investments in commercial property, then the idea of a significant portion of the workforce working from home is terrifying to you, because it will affect one of your income streams. And I'm not making a moral judgment about that. I think that is a perfectly logical response to a very real threat to your fortunes, plural. So I get that side of it, but I don't understand why the almost certain contribution, the almost certain and certainly epic contribution to this constituency of Brits, people who are signing on for poor health benefit payments, ignores the fact that almost every single family in this country will either contain someone or contain someone who knows someone who thinks that they have or knows that they have what could be very loosely described as long COVID. And I don't know how we test this. I don't want, and I know this makes me sound like a bit of a git, I don't want you to phone me and tell me your symptoms. All right? Sorry. Your symptoms may well come into your conversation, your contribution, but that is a little bit like saying, if you ever need to demonstrate to someone new at LBC that making the phones ring is very, very easy, you usually say to them, you would just come on air and say, is there anybody old out there feeling poorly? And boom, your phones go off like a firework display. And this, sadly, would be a little bit similar. So I know about brain fog, I know about lethargy, I know about exhaustion, I know about some of the mental health conditions that have been massively exacerbated in the realms of OCD and ADHD and things like that. I've done probably a little bit more research than your average journalist who's not on the health brief. And I don't know why it's not talked about more. And that's my first question. Why do you think it's not talked about more? 0345 6060 And I think, and again, I will withdraw this if it's a mistake. I think I want to separate physiological from psychological. Now, I know that the lockdown itself will have affected our mental health in all sorts of ways, particularly children, particularly the cohort who was starting year 11 in the first September of it, just before it started. But I know that. So anxiety and depression, agoraphobia, being frightened of leaving the house. I know all that is there, but for the purposes of this conversation, I think I want to keep it separate for one very simple reason. That all existed before COVID. Those conditions existed before COVID. I'm really, really interested in how you know that you can't go to work at the moment because you caught COVID a couple of years ago, or you caught COVID, or you had COVID. You've never quite got back. Okay? Now, you don't have to prove yourself to me. I believe you. Right? And that's why I hope that we can just tiptoe over symptoms and conditions. I believe you. I believe that you've never quite, in fact, not even quite, that you've never actually been fit for work on a regular basis or at all since you got COVID, okay? And that's why I'm distinguishing between physical and mental, because lockdown isn't something that you caught. It's not viral. So the mental health responses to I may be overcomplicating this for you, but I want to talk about long COVID. But the first thing I want to know is why that sounds novel, why that sounds original, why this isn't a conversation that is dominating every single mention of the fact that half of claims for Britain's main benefit will be for poor health by the end of this parliamentary term. Half of all claims will be for sickness. Now, look, there are other factors. There are lifestyle factors. There are obesity conditions. There's diabetes, there's strokes, heart attacks, and some of those may be linked to COVID and some of them may not. But I'm not necessarily talking about them. I'm talking about the double knowledge you have that the reason why you're not going to work today is somehow linked to the COVID you got back in the day. And the question of why we are not talking about it more is a weird one to do on the radio, because you're perfectly welcome to ring in and say, James, I think you'll find you are talking about it. But you know what I mean. Why is it not a much bigger part? What are we scared of? That's why I mentioned the corporate landlords. I know what they were scared of. What are we scared of? What is government scared of? I don't know that media is scared of things I on this front, but maybe you think they are and you can tell me why. Why is this not a much, much bigger conversation, given that, and I could be wrong, it may be that I've opened up this conversation, no one will ring me, and we'll come back after the next break and we'll have to talk about the pedestrianisation of Birmingham city centre. But right now, I think that millions of lives, I use that word advisedly, millions of lives have been affected by this, either directly or indirectly, and yet it feels as if we have been either ignoring it or living in a box or very willfully looking the other way, and I don't understand why. Okay, 0345 6060 973. How confident are you that you are not in work because of long COVID, and why is it a conversation that the country seems so reluctant to have? And that's a good way of phrasing it. The country seems so reluctant to have. The other thing I want to do, sorry, and this is really important, is medical professionals and patients talking to me about the process of acknowledgement. If you didn't study something in medical school, it sometimes seems that doctors can be quite sceptical about its very existence. New conditions, relatively new conditions, can be greeted with sometimes quite rude responses. You could be accused of paranoia, skepticism, Munchausen syndrome, or whatever else it may be. So I want to hear that from both sides of the fence. Doctors who can't believe we're not having the conversation more, and patients who can't believe how blind their doctors are, forgive me, how unreceptive their doctors are to what you consider to be the obvious evidence, the obvious case. So is it keeping you from work? 0345 6060 973. How are you being treated by the system? And why is it a conversation that the country is so reluctant to have? It is 21 minutes after 10, so you should be able to do the maths here quite straightforwardly. Half of people claiming any benefit at all, or claiming the country's main benefit, will be for poor health by the end of the parliamentary term. The calendar tells us, a simple clocking of claims tells us that a post-COVID surge looks like becoming permanent as Britain's health declines. Correlation is not causation, but COVID is almost certainly, therefore, a part of this. Meeting the threshold to receive the benefit is high enough to get rid of all the applicants for Idiot's Corner this morning, claiming that it is swinging the lead, or people taking the mickey, or people who are on the lam. There are always some bad actors in any context, but you do not let their existence deny help to the massive majority of good actors. So you knit all of those things together, and if you want to be capitalist about it, which is, again, not a dirty word on this programme by any stretch of the imagination, then the economic health of the country would be enormously enhanced by making a lot of people better. And therefore, the government should, I would have thought, or at least this government, because it doesn't bear responsibility for the appalling pandemic management of the last administrations, should be making a lot more noise, putting it a lot more front and centre. 23 minutes after 10 is the time. I want to know. I mean, there are reasons. There must be. I can't currently see many of them. Hannah is in Glasgow to kick things off. Hannah, what would you like to say?
Hi. So, I'm just calling because my mum fits a lot of the things that you've been talking about.
Yes.
She is actually also a doctor. She's now retired.
Okay.
But she kind of caught COVID during the pandemic and was never the same since.
Yes.
And she was able to continue working until she retired after COVID, but she's now, she wouldn't be able to now if she was still in work. Because
because her health is compromised.
Her health, she can't walk. Really.
And as a doctor, doing self-diagnosis, she thinks this is a consequence of what happened when she had COVID.
Both her and the various, she's seen lots and lots of specialists.
Right.
It's been ongoing for obviously a while now.
Yes.
But it's got worse over the last kind of 2 years, I would say, that particularly this year. But the specialists are saying that it's long COVID, and it's post-viral. It's a consequence of
post-viral is good. That's a good phrase. And the slowness of that process is down to the novelty of the condition. We're familiar with post-viral conditions, but nobody studied long COVID in medical school. And so in my experience, and that's why I'm interested in what a medical family has to say about this, the medical profession can be a little bit reluctant to acknowledge the existence of things they never studied at school.
Yeah, a lot of my family are doctors, and I think various members of my family find it very hard to believe that it's
even when
COVID.
It's a family member.
Yeah, they sort of see it in a similar category to ME.
Yes.
Which is also kind of a sort of slightly difficult one in terms of
highly debilitating, and yet, medically both new and not.
There's not really anything that they can say, this is how we fix this in the way that they would like to. And I think that's kind of partly also why it's not being talked about enough.
So it can't be fixed with rest, sleep, all of the usual things that you might treat something with. It can't. It doesn't touch the sides. And that might be why the medical... So you recognise that the medical establishment is reluctant to talk about it. Any thoughts on why the government wouldn't want to? How can you talk in the same breath about half of Britain's main benefit claims being for poor health and a post-COVID surge in claims becoming permanent and not join those dots together politically?
See, my thoughts are that it's possibly because the government are maybe being they're being cautious because the medical profession isn't sure. Maybe because they actually listen to experts. This government are kind of claiming to listen to experts and take expert advice, with the prison service and things. Yes. So maybe they're trying to hedge their bets a bit. I don't know. That's not the right phrase, but they're maybe willing to kind of go full in.
The wheels turn slowly. We were talking about it in the context of justice earlier this week. I suppose in the context of medical research that the wheels turn slowly. Thank you, Hannah. And a former doctor, absolutely convinced that the reason why, if she were 20 years younger, she wouldn't be able to go to work. She's retired, so she isn't anyway, is as a consequence of the hangover, the post-viral consequences of her COVID. But not for balance, because I don't think we need balance on this conversation, but for your information, this is from an entirely reliable social media account. I sign most of the sick notes in a busy GP practice. I can confidently say that long COVID is rarely the primary reason. I suspect that COVID exacerbated a host of underlying and previously controlled long-term conditions, like COPD, diabetes, and anxiety and depression. That's why I was a little bit wary of separating them out. Because if your long-term condition for which you are being signed off work is a consequence of having COVID, then in the great scheme of things, it could be filed under long COVID, but not in the sense that Hannah and her mum talk about it, which is a very specific post-viral response. Maybe this already sounding complicated is part of the reason why the conversation is not had more widely. It's coming up to 10:28, 0345 6060 973. Is the number you need. Gus is feeling, I think, rightly aggrieved this morning. James, he writes, on behalf of bad actors everywhere, please stop blaming us for everything. We are merely trying to entertain. Alan is in Wandsworth. Alan, what would you like to say?
Good morning. I think that there's two different responses from two different governments. Why don't people want to talk about this? The previous government were keen to get people into work. They wanted to protect the economy ahead of wealth. In my opinion, they made some very, very poor decisions around the management of COVID. The current government, I think, have bought the line, I hope only for the time being, that it's just a cold.
Oh, okay.
And we as a species...
Even as the inquiry unfolds, and you've got medics breaking down in tears, and we've got death tolls, and we've got that incredibly powerful memorial wall on the which you can almost see from Westminster. I think you can see it from. You still think that they've subscribed subconsciously or consciously to that?
I think yes. I mean, Hannah's comments I thought were great just now, and I completely subscribe to everything that she said. So add mine on to what she has been saying. But we as a species, we don't like change. We don't like looking at our long-term. We don't like making assessments of risks about our long-term health impact. Otherwise, none of us would eat sugar and none of us would smoke. Yeah. It's survivor bias.
So out of sight is out of mind. I haven't got it. It's not affecting me. And therefore, let's all crack on.
Cold.
Well, but at which point, though, half of claims for Britain's main benefit, and they're not all going to be long COVID. I don't want anyone to go away with that for even a nanosecond. But at what point does the calculation or the mathematics demand that they start paying more attention to it?
I think probably soon after this phone-in of yours, I rather hope.
I think you're giving us a little bit more heft there, Alan, than we enjoy. Can I ask what your angle is on it? What's your sort of point of interest?
I'm desperate for the government to learn about this and to change. I believe this is a mass debilitating event for society, and it's the post-acute sequelae. It's not the impacts of the actual illness when you get it, bad as that is for many people. It causes there is almost. I've researched this since it first came out. I couldn't understand why, in August 2020, people were being reinfected with it, because textbook viruses that doesn't happen according to textbooks and viruses. This we're in a cycle now of infection, spreading it because it's just a cold and everyone's scared of wearing a mask. Infection, spreading it mutates, it reinfects.
And just, I think I've missed some. Yeah, and then that gets in a vicious. I mean, by definition, it becomes a vicious circle.
Yes.
I think I may have misunderstood you slightly. So when you use that phrase, they think it's just a cold. Is there a silent now in that sentence? They think it's just a cold now, as in it wasn't just a cold when people were dropping dead all over the place, but now it's been dealt with. The storm has passed, is what they think.
Well, they're rather hoping that it's becoming milder, and it's not the problem in the acute phase, bad as that is for some people.
Of course.
Still. It's the post-acute, I've learnt this word, sequelae. The health condition as a result from a prior health condition. It's a cardiovascular disease.
Okay.
Why even the British Heart Foundation on their website, they've tucked it away now for some reason, but it's a cardiovascular disease. Why are strokes going up? Why are heart attacks going up? It's causing blood clots. It makes the blood sticky. It causes monocytes to become thrombotic.
The more you talk, the madder it is that they would be looking away from this, and they wouldn't be talking about it. Thank you, Alan.
Absolutely bonkers.
You made me a little late for the news, but I think that was worth the delay. I should also point out that I don't think, when you suggest that the reason why the government doesn't want to talk about it is because of all the anti-vax idiots who are still floating around the place, I don't think that the government conversation with population is ever defined by conspiracy theorists. You've seen that in the context of the Southport tragedy and the ongoing investigation and prosecution of the suspect up there. The government starts dancing to the tune of idiot conspiracy theorists. We're all doomed. 25 minutes after 11 is the time. I missed that. I just heard in the news Gillian Keegan. Remember her? Describing the decision to put VAT on school fees for approximately 7% of the nation's parents as cruel. Is it worth making a short list of things that Gillian Keegan didn't describe as cruel when successive conservative governments since 2010 were bringing in the policies? I don't know that we'd have time, would we? We'd probably have to eat into Sheila's show and tell Ben Kentish to take the rest of the day off. But it's interesting, isn't it, how moral compasses work? And that's something I may turn your attention to a little later in the programme. 10:36 is the time. Here's Andrew Gwynn at Work and Pensions Questions in the House of Commons. I'll have it for you shortly. Last year or earlier this year, before the Labour government came in, it was March of 2024, just speaking to the mystery that I am citing today, the mystery of why the conversation is not being had more. I think Alan knocked on several relevant doors. I think there's probably a little bit of hit and hope going on here, where you sort of think, well, we're over the worst. Obviously, there is some post-viral consequence. Long COVID is a thing. Lots of people can deny that, just as they denied ME was a thing. But, the truth will out. My Idiot's Corner friends who are still insisting that it's all a skive or know nothing about the process, A, of getting signed off, or B, of having it. But, I acknowledge your existence because your vote is worth the same as mine. And yet, when you look at the benefits bill, I see. Sorry, I'm being a bit thick myself there. Idiot's Corner for me, briefly, is that you think everyone on benefits is a liar, don't you? So these people must be liars too. Well, there you go. That's easily unravelled once you turn the lights on. But if you prioritise the economy and prioritise the workforce and getting people back to work, then looking after them, making them better, is, or should at least be, at the very, very top of your to-do list. Beatrice puts it well, we need to get people better. Listen, we could get all Marxist about it, couldn't we? And describe how this is treating people as economic units or valuing them only according to how much work they are able to do. But I'm thinking about people who want to work but can't. We need to get people better. That means believing people when they are sick and have chronic illness or disability. It means not turning away people with ME or CFS, usually women, but men as well. And lots of other conditions, that the Lyme disease, long COVID, other multi-stranded chronic illness. There's no NHS pathway for a lot of these things. I think Miranda Hart has written very powerfully recently about being bedbound for I mean, I think years rather than months as a consequence of one of these conditions. And because Miranda Hart is one of the most successful entertainers the country has produced in the last 20 years, I presume she's immune from the accusation of lying or being lazy or making it up. I haven't read her new book yet, but I think it goes into a lot of this stuff. She might be worth talking to. But when you see the economic necessity of doing it, the mystery of why they're not talking about it becomes harder to unravel unless it is just hit and hope. Well, look, we'll be quiet and eventually it might go away. So when you read that the post-COVID surge in sickness benefit claims is likely to become permanent, it's probably time to realise that that plan isn't working. Rosamond is in Lewisham. Rosamond, what would you like to say?
Hello, James.
Hello,
How
Rosamond.
are you?
Very well.
I realised at the beginning that this was a problem in January 2020 when I got a phone call from a hospital and a very senior medic told me that people who were getting COVID at that time had very similar symptoms to my late daughter.
Oh, Rosamond, I thought it might be you, but I didn't want to impinge by asking. So you've been in the news as well yourself lately after the government apologised to you over Ella's death and its link to air pollution. And as you know, you're in our thoughts all the time, but you're in our thoughts particularly yesterday.
Thank you.
No, thank you.
So, I just want to solve some of your problems. So
Yes.
I've come up with some of the solution. I deal with children, as you know, and obviously they don't claim benefits, but I was alarmed by the amount of children that had not returned to school since COVID.
Yes.
So what I managed to persuade the Mayor of London to do, and I hope I'm not revealing a secret, is to put air filtration into all London schools. And he's going to start this next year. Because I thought rather than wait around, because if COVID, it was that severe that people were having symptoms similar to my daughter, I knew there was going to be a major fallout. See, I worked it out, but no one was really listening. But you know what I'm like, James. I
certainly do, Rosamond. And I don't think that you've betrayed the Mayor's confidence I think it starts off in the most polluted areas, doesn't it?
Yes, it does.
And then hopefully spreads, because as you say, I think other countries were doing this quite early on, specifically for COVID, not for the pollution issues that sadly took your daughter away.
And there is a link. So in areas of high air pollution, not only did people get COVID more severely, more people died from COVID. So I will be able to give you more of your answer next year because we've taken Ella's samples to do some testing on with her siblings. So I will have a definitive answer for some of the questions, hopefully, from Oxford University. So hopefully everyone in London, in schools, over the next 4 years or so, they will all get air filtration.
Wow.
And I hope to meet the mayors of all around the country to persuade them, James, that this is a real problem and they need to do something about it.
And I'm struck by the memory of a fairly senior public official at the COVID inquiry recently still denying that it was an airborne condition. So that's part of the problem we're discussing today.
That's part of the problem.
The reluctance to talk about it and the refusal almost to understand it. Not just a failure, but a refusal. Where do you think that comes from?
I think there was we got it wrong, and I'm talking about public health point of view, all the messaging. And I think we have to accept some of the responsibility for that. I can't really talk about why government won't take it on. Maybe it means spending money. I can't answer that question really.
Sure.
But I think we need to do something about it because I knew, by the way, that the burden of disease was going to be huge. I was expecting that.
And,
so I'm sorry
to
everyone who is ill. I'm very sorry about that.
Well, I don't think anyone's going to blame you for it, Rosamond. But I mean, you do the Lord's work when it comes to drawing attention to these issues and the broader issue of air quality anyway. And can I ask, while I have you, how you feel about yesterday's announcement? You must have known a little bit earlier what was going to happen, but for people who don't know, Rosamond's daughter Ella became the first person in the history of this country to have air pollution cited on their death certificate, largely as a consequence of the tireless work that Rosamond herself did. And yesterday you received the full acknowledgement, the full apology from the government and compensation, which of course is the government's way of acknowledging culpability in the context of this kind of situation.
How do I feel this morning?
Yeah.
Relieved for my other children. It is over. It's been long, 14 years.
Yes.
I'm tired, I'm exhausted.
I bet you
So I will regroup after Christmas. But thank you to all the public who have supported us with this journey.
And that does feel... I don't want to sound like a Californian psychotherapist, but you do feel a sense of closure then, clearly.
I can talk to you now and say anything I want. Hence, I rang up over COVID.
Yes, I see what you mean. Well, and I think the work you continue to do in this field is a rather beautiful memorial to Ella, and you know that we'll do what we can moving forward to help you get all the attention that you deserve. Rosamond, thank you. Rosamond, for anyone who doesn't know the full story, Rosamond Adukisi Deborah. 10:44 is the time. You're listening to James O'Brien on LBC. Those HEPA filters are one of the things that pops up whenever I scratch the surface of this issue. And it ties in slightly with something Kim sent to me. She says, I was always very intrigued that the Chinese government, which arguably knew more about the impact of COVID than any other government and which values life so little normally, that's a powerful line, which values life so little, took such extraordinarily extensive measures to stop it spreading through their population. 10:47, you are listening to James O'Brien on LBC. So the Labour MP Andrew Gwynn did raise this in the House of Commons last March, and I think that the absence of an answer to this question has just become more and more dangerous and puzzling. And of course, he's now a member of government, so next time you bump into him, ask him if he's still rattling this particular cage.
As somebody who has fought really hard over the last 4 years to overcome the difficulties presented by long COVID, I'm sure the Secretary of State will appreciate that a significant number of people not in work because of health conditions will be down to some form of post-viral fatigue linked to long COVID. So what assessment has he made of long COVID on the workforce, and what's he doing to help people get back to work who have it?
I think the answer was not a lot, but I'm open to correction on that. That was the only clip I could find. Debbie speaks for many people contributing to the programme, and she writes, my son has it. He had to leave university before finishing his degree. He's at home. I'm caring for him, so I can't work either. And whilst the GP acknowledges it is long COVID, he's not referring him. He's refusing to refer him to the long COVID clinic because, in his words, they don't offer anything useful. So if there's nothing in place to improve the situation, why would anybody draw attention to it from the political sphere? Well, children, because that's how you start the process of creating something that will be in place to improve the situation. I would have thought to fix a problem, you've got to acknowledge it, which is probably a timely moment to say the word Brexit for the first time on the show today. Gareth is in Cwmbran. Gareth, what would you like to say?
Hi there, James. So my name's Gareth. I'm a trustee for the charity Long COVID Support.
Okay.
So this is something that's very sort of upfront in our minds at the moment.
Clearly.
So this I have to say there's probably quite a lot of facets to this. I think.
Shall I ask you questions rather than expecting you to sort of regurgitate all of the stuff you know, because you probably know more about it than I do?
Yeah, go for it.
So, what is it possible to generalise about the response of the medical establishment to people presenting with long COVID? Is there a sort of broad picture of what reception they are likely to receive when they go to the doctor?
I mean, it's very variable because. Depending on where you are in the country, you mentioned the long COVID clinics.
Yes.
I'm aware there are some in England. At the last count, there were apparently 90 long COVID clinics and 13 hubs for children and young people. However, we are hearing reports that some of those are now closing down due to lack of funding. But elsewhere in the country, in Scotland, Northern Ireland and Wales, there are no sort of dedicated clinics.
Right.
And, you know, depending on who you speak to in the medical community, you'll find that some are quite clued up on long COVID, but then there are others who maybe sort of don't recognise it or are quite dismissive about it.
How abandoned do you and your fellow supporters and members of the charity feel? And that's an emotive word, so feel free to poo-poo it or dismiss it, but that's the word I'm starting with.
I think it's a fair comment. That we feel abandoned. We feel, we are involved in the current COVID inquiry at the moment, and it's been very often talked about that we feel like the forgotten victims of the pandemic because the focus was on the people hospitalised and who sadly died, and that's we appreciate that. But then there's the long-term consequences of the pandemic, which unfortunately is still ongoing.
How has it affected you? Is it you or is it a loved one that you're advocating for?
I have long COVID, myself, yeah.
So I know I put probably too much effort at the top of the show into telling people not to ring in with their symptoms, but we should hear from at least one sufferer of how it has affected you. What's it done to you and your life and your family, Gareth?
It's had a profound impact on my life, quite frankly, yeah. So in terms of my physical health, I was fit and active before. I was doing triathlons. I can't do that anymore. I'm doing some form of exercise, but nowhere near to the extent I used to. My career has suffered. I was in a good job, a professional, qualified, and I'm finding I'm having to sort of adjust to what I'm able to do now.
And why do you think the conversation is still so quiet?
As I mentioned, I think some of your previous callers have touched on a few points. I think the issue at the moment that we're finding is that because there's no diagnostic test for long COVID, we don't know how many people have long COVID in this country. We've got the only thing we can hang our hat on at the moment are the ONS updates.
Yes.
At the last count in March this year, there were 2 million in England and Scotland with long COVID. These are self-reported cases. So these are people that know that they have long COVID. And as one of your previous callers mentioned, there are health consequences around, heart attacks and strokes that we can't say for sure, but we've got a good inclination as to what's causing those, and that's COVID and long COVID.
And then the mystery gets bigger, doesn't it? Of why? I mean, because if you are looking at it from an exclusively economic point of view, this is disastrous on every single level, and that's ignoring the psychological and social damage that it's doing to you and families like yours. Is there anything else you want? Because I said I'd try and tease out the salient points rather than expecting you to sort of cough up an entire essay on the subject. But is there anything I haven't touched on that you wanted to bring to a wider audience, Gareth?
I think you mentioned it briefly about why the government's maybe resistant to addressing this is that it requires investment in research and clinical trials, and there's this whole thing around COVID being an occupational disease, in which case employers would have to provide safeguards, and which requires an initial investment. But unless they do that, what we're finding is that the burden of the sickness levels in this country are going to get to a level where it just becomes unsustainable. The benefits, and that will cost more.
It will cost more in the long run than it does in the short run. Wednesday was a budget that, for good or for ill, prioritised short-term expenditure in the pursuit of long-term improvement and saving, but not on this front. Maybe it was a front too far. Gareth, take care. A lot of love for you coming into the studio. And just as Debbie spoke for many when she described her son, so Tim speaks for many of you when he describes his mother. James, can I just say thank you? I'm desperate for long COVID to be in the spotlight. My mum's been suffering for years now, still has no explanation or answers. It's brought on severe OCD, I'm hearing that a lot as well, and her life is as good as over. It's like people with the condition just don't matter. So Tim in York says thank you, not just to me, but also to people like Gareth, of course, who by working with the charity Long COVID Support, at least try to draw the spotlight to this situation. And it is still baffling, right? More baffling now than it was at the beginning of the hour, that the conversation is not held more widely. We have had it once or twice before. From various perspectives, but the sense of momentum is not there. And I think that we've spoken to Lara in Fareham about some of the attendant issues as well, most recently, when the inquiry first kicked off. Which of the questions that I've asked today are you keenest to answer, Lara?
Oh, there really is so much that impacts our organisation. So I represent clinically vulnerable families, which is a group which speaks on behalf of all of those who remain at higher risk from COVID infections. Those people who continue to qualify for COVID vaccines, some of whom also will qualify for antiviral treatments if they can get hold of them. And to be honest, that's another whole issue. I think when you talked about that surge in post-COVID claims for benefits and things, we found, and I urge you to look at this data, actually, James. Since Freedom Day and since Living with COVID were announced, there was a massive increase at those points in time, particularly, and I would say, and I would agree with your GP, from people who remain vulnerable to COVID. And it often goes down as anxiety and depression, as the GP said. But you said COPD, diabetes, all of those other conditions that put them in those high-risk groups from the worst outcomes from COVID have not been protected sufficiently. Their needs have not been considered. They've been forced back to in-person work. Workplaces have not been kind of made safe. And, where Rosamond was talking about her amazing work to kind of get air filters into schools, we would very much support that, and we've been fighting for this, for a long time now. We very much do believe that air filters do need to be in place in all public buildings, as was actually said by Chris Whitty in the COVID inquiries not long ago.
I wasn't 100% sure of that, so I didn't say it out loud, but you're absolutely right.
He has recommended this.
Yeah, I knew there was something.
This is a huge problem, and it's a massive gap, and it's causing problems for people accessing healthcare safely. So, also our people are high users of healthcare, and they cannot get into those buildings without risking contracting this virus. What
do you say in response to the question of why the conversation is not louder? And in a sense...
Okay. I have a very kind of sort of clear view on this.
Good.
There's a post-pandemic trauma that has been experienced by everyone in the country. And we see it. We see it, and as our members go around and they wear masks because they have to continue to protect themselves because nobody is protecting them.
Yes.
And so they have to take personal responsibility, as the government told us. But personal responsibility leaves those with the greatest burden of risk to carry the most responsibility. And I think that's wholly unfair. And we're not living, we're a massively marginalised group. We're not getting the support. We're not considered. We're not even an equality group.
No.
Nobody considers us in equality impact assessments. We are a different group to disabled people. You can be disabled and not clinically vulnerable. You can be clinically vulnerable and not disabled. We're not protected under the law in that way. In fact, we're a bigger group than disability. But nobody's considering our new needs since this new virus has emerged.
And that is partly due to the trauma you described, the sort of collective social trauma, and partly probably due to slightly more prosaic reasons or pragmatic reasons, like the size of the elephant in the room and the cost of dealing with it.
Exactly. And, our members, I've told them because nobody is collecting our data.
Right.
82% have lost work or retired early since the pandemic. Right. That's insane. Nobody's talking about this.
82%?
Yes.
Of your membership?
Yes. Lost work. Not necessarily. Some of them may have returned back to work, but, at some point they have lost earnings
and a huge,
or lost jobs.
And that will be a large part, or rather a large part of that will be people who are also signing on for benefits to get them through those periods of inactivity.
Exactly. And actually, some of that lost work will have been from people who live in households with clinically vulnerable people as well. So we're clinically vulnerable families because it affects the entire household. It's not just that one person who's at risk. The household has to manage their risks.
Indeed. Laura, I mean, crikey, the burdens you bear, and Gareth and almost everybody else who's contributed to this programme, and it's one of those really weird conversations from my point of view where you sort of sometimes think that I don't make it worse for people like Laura and Gareth and everyone else who's contributed, but for those of us who just have the luxury of wondering and worrying, the more you talk about it, the bigger the wonder and the worry become. So imagine what it's like if your whole life is in the balance as a consequence of it, of this continuing silence. Answers on a postcard, please, for what the hell we can do about it. I don't even know which part. I suppose Wes Streeting in the first instance would be somebody who might be worth buttonholing. I do see him occasionally in the lobby. It's 11 o'clock.